one and work your way around, but it's not easy. So we'll start with Claire, please.
Hi, my name's Claire Birch and I'm the Information and Communications Coordinator at Healthwatch Rochdale.
Thank you. Mel?
Hi, I'm Mel Tunney. I'm a volunteer board member at Healthwatch Rochdale.
Stephen?
Hi, Steve Sanderson. I'm a volunteer board member at Healthwatch Rochdale.
Rob?
Hi, I'm Rob Butler. I'm the company administrator for Healthwatch Rochdale.
Thank you. Kate?
Hi, I'm Kate Jones. I'm the Chief Exec of Healthwatch Rochdale.
Simon?
Hiya, I'm Simon Wharton. I'm non-exec director of Healthwatch Rochdale.
Margaret? You're on mute. You're still on mute. That's it.
Thanks, sorry about that. I'm Margaret Parker, Healthwatch Rochdale volunteer board member. Thank you.
Okay. David, you're on mute as well. You're still on mute.
Sorry about that.
That's all right.
Oh, that was confusing. I didn't know whether we were having a meeting or not. David Bradshaw, I'm the treasurer of Healthwatch Rochdale.
Thank you. And Ben?
Hi, I'm Ben Greenwood. I'm vice chair. Apologies, my video's playing up a little bit, so I'll just do it on vocals
Thank you.
today.
We'll all just about get used to how to work Zoom properly, and then we'll all be back in the office. So, right, thank you very much. I know we've had apologies from Rosemary. So, without further ado, we'll go on to Kerry to say thank you very much, Kerry, for joining us. It seems to have taken a while to get this because I know you were supposed to come a couple of other times, but things got in the way. So welcome, and Kerry's from Action Together, and she's going to talk to us about, I don't know, because it doesn't say on my program.
Surprise.
Surprise. Yep, so I'm Kerry. I'm locality lead for Action Together. I cover the Rochdale area. So Action Together sits over Tameside, Oldham and Rochdale. And we're the community and voluntary sector infrastructure organisation. So we strengthen communities by supporting the voluntary sector. We've been heavily involved in the community response, but I wanted to talk to you today about what happens next from a voluntary sector point of view. So I'm just going to attempt to share my screen. I was just saying to the others that I'm using someone else's laptop today because mine's gone a bit kaput. So here we go. Yep. Okay. Can everybody see that?
Yeah.
Lovely. So we're moving into a bit of a phase now that we're calling respond, repair and recover. Much of 2020 was about responding to need, and you'll see in a couple of slides on how we did that. And we're still responding. The voluntary sector is still responding to needs around food and wellbeing and practical support for people. Also things because of the pandemic, so work around equalities and work around finances and supporting people in that way. And so we're really pleased that we've secured an investment of £790,000 over the next 12 months. And that's through a variety of sources from central government mainly, and that money is for the voluntary sector. And we're going to organise that programme in two ways. So through some small grants, so small grant scheme focused on responding, repairing or recovering from the effects of pandemic. And we welcome applications that address inequalities or support and enrich and develop communities. We found during the pandemic that having the community response fund meant that we could very quickly find and communicate all of the voluntary sector activity and link it in with statutory partners so that when people rang the emergency helpline, they could be connected to something local to them. So the small grant scheme, I'm really pleased that we've kind of bolstered that. And then the second part, which is something that's slightly different, And this is the hard part. So we're going to focus on thematic collaboration. So we're going to invest in collaboration networks of voluntary sector organisations who've come together to address inequality, sustain community provision, and co-produce projects and work that benefit people and communities around identified themes. And I'll come on to how we're going to do that and what we're doing around that in a minute. Just first of all, I want to outline what we mean by respond, repair and recover. So I'm just going to read this out. So respond, we recognise that community action continues to take place across the borough in response to the pandemic. We value voluntary, community, faith-based and social enterprise sector organisations, mutual aid groups and individuals supporting communities through their action. We want to encourage and support this action. And then repair, we recognise the damage caused by the pandemic and have witnessed how the pandemic has deepened inequalities. We want to be part of repairing the damage to communities by supporting the voluntary, community, faith and social enterprise sector. And then recover, we recognise that the world has changed and that the voluntary, community, faith and social enterprise sector offer needs to flex to meet new needs and adapt to enrich communities and enrich and support communities in new ways. And we want to help create a better future that communities deserve. So when I'm talking about voluntary, community, faith and social enterprise sector, we're a membership organisation. So we have over 200 members that fit within that category. And those members support a wide range of beneficiaries across the whole borough. Some of them support because of a specialism. So we might have an arts organisation supporting creatively. Some of those organisations might be set up around a faith-based organisation or connected to a particular area, so a geography. And some of them might be set up to support a community of experience or a community of interest. So the South Asian community or maybe people who've been homeless. And our offer is to support around volunteering, development of those organisations, partnership work and collaboration within the voluntary sector, but also between the voluntary sector and statutory partners, and then investment. So that's our grants programme and the investment in the thematic networks. So our approach to developing thematic collaboration, we use this model. So it's developed by the Design Council. It's kind of a tried and tested model for co-production. It's about identifying a challenge, discovering what's available, what's out there, defining what we're going to do about it, developing some potential solutions, and then testing and creating some kind of outcome that solves a problem. And we think that we can do that within the sector with this network approach rather than a kind of lead provider or commissioned piece of work. So a real life example of this is the community warehouse. So we have, at the beginning of the pandemic, there was a lot of need around food. People were needing their shopping doing, but people were also needing food and losing their jobs and not being able to pay for food. The food banks and food pantries all have experienced a big increase, about threefold in the need for their provision. And we were receiving a lot of grant applications from organisations that didn't necessarily do anything to do with food before the pandemic, but wanted to repurpose their offer to support people around food. And there wasn't any way of those food banks, food pantries, food providers, church and mosque-based organisations who were now offering food, there was no way of them connecting to each other. So we developed something called the Food Solutions Network. And we did a piece of research. So we looked at what's the problem we're trying to solve. And we found out some really alarming statistics around how the food provision need had changed. We then thought about who knows this problem best. So we built relationships with those food providers, but also with people that use the food banks. And we had some volunteers who are part of the Food Solutions Network because they've got lived experience of using food provision. And then, of course, on Zoom, we explored lots of possibilities and we asked the group, what do you need? And we thought they might say money or something else, but what they said was storage and redistribution. So some food banks, maybe in more affluent areas, had a lot of surplus stock. Some were buying stock themselves out their own pocket. Some had were getting referrals from places far away from them, and so they needed to be able to refer back to the other organisations that were nearer those people. So we created something called the Community Warehouse, which is it's a redistribution centre. It's at Sparth Community Warehouse. It's run by volunteers. We've got one member of staff in there, and we focus on the art of contribution. So we ask for lots of stuff, and we ask for different people within the system and the communities to contribute. So we have a borough-wide street ambassador scheme that collects doorstep donations for the warehouse, for the stock. The council help us out with getting rid of waste. We work with a charity called Skill Mill that employ young people that have offended more than 11 times, and they give them a job and teach them skills so they come and work at the warehouse a couple of days a week. People drop off their surplus food, but also collect stuff that they need. And it's a sort of cash and carry for the voluntary sector without the cash. So people can request what they want and come and collect it, and then just offer what else they need. And adapt, refine and involve. So we now offer care packages out of the warehouse as well, which might be kind of home learning kits for families, or it might be hygiene kits or cleaning packs with very liquid and, well, not very liquid, washing up liquid and spray and things, so that people can have that alongside the food. So charities and organisations can collect what they want and then serve the people that they look after in their communities, and it's all free. It's all free because we secured some money from DEFRA. I think it was 118,000. Although we're on YouTube, aren't we? Don't quite quote me on that. 100 and something thousand for this work for the next 12 months. And then the Economic Support Network, which is a similar network that of organisations brought together around the fact that people were needing increased financial support. Their sort of product that they've developed so far is this financial support toolkit, which is available online. And instead of it being a directory of services, it's a pathway tool. So it helps people navigate a system based on what their priorities are. And this has been developed in collaboration with about 30 organisations and the council as well. The digital tech library is operational. So again, this is a partnership of 10 charities that have come together around digital needs, and the partnership is made up of organisations that support different cohorts of people in communities. So older people, young people and families, women and families from Black and South Asian communities, refugees and asylum seekers, and people living with mental health issues. And since its launch, we initially secured, there was first of all was £5,000, so that they group bought some tablets, and then there was another 20,000 that came from the Community Response Fund. And then we've just, as part of this big investment that I mentioned earlier, there's another 118,000 for the Digital Tech Library Partnership. And that will be spent on a mixture of tech and support for those charities that are involved. And they're co-designing what they're going to do with that. And the idea is that anybody that needs some tech to access the health and social care services, or just general social and life opportunities, will be able to borrow some tech from either the library or one of these charities as part of this project. So I've just popped our values around the outside here. So strengthen others, be true, and believe it's possible. And these collaboration networks rely on three things. So from external organisations to action together, we need to find the energy and passion and drive and capability and capacity. And then from us, we provide a process, so a statement of intent and facilitation of that collaboration. But we really need external support as well, external to the voluntary sector. So budget. We need some budget to make this work. System relationships and external support. So our collaboration networks, we can send this link round afterwards. Sorry, this presentation round afterwards so that you can follow the links. So the Emotional Health and Wellbeing Network is at the very beginning of this co-design process. They've identified some challenges, and we've had one co-design session to think about what we could do about those challenges. Women's Services Network is in a similar place. The Economic Support Network, they're doing really well. They've got this financial support tool, and the next priorities are around making that financial support tool accessible for use in different communities, and also a funding mentor scheme to train people up so that we maximise the amount of funding coming into the borough. The Digital Tech Library, they are sort of in the middle. So they've done some great work, and then now they're thinking about scaling up. And the Food Solutions Network are really, they have their outcome of the community warehouse, and they're thinking about what to do next, and what's their next big challenge. And that is the end of my presentation. So I'm happy to take questions or thoughts or ideas from everybody. I should also just quickly mention, sorry, we have the Equalities Assembly coming up next week, which is, Healthwatch have been supporting us with this. So it's the third Equalities Assembly, and that's the opportunity to talk about topics that are really important to grassroots organisations and communities. So I'll pop the link in the chat in a minute if anybody wants to join as well.
Thank you very much, Kerry. That's very interesting. It is. We do know there's plenty going on in the borough, and it's nice to see that. I mean, I do know about the community thing, because I remember we had leaflets in our door asking us to contribute to all of that. So, well,
that's what you're contributing to. That's, yeah, that's
yes,
that
was a couple of weeks ago. But Kate, you had your hand up, I think.
Yeah, thank you. Just really to let the board know that we are involved in certain elements of the work that Action Together do, and we have been successful in 2 funding bids for the care packages. So we're looking at getting them out, and we chose hospital care packages for long-term patients in hospitals. You know, visiting's limited. So we're looking at putting packs together with Healthwatch Rochdale information on. And then in line with our Youth Watch development work, we also chose a youth package for males and females, looking at deodorant, sanitising materials. So we'll be getting them out April time. So just to let you know that we do get involved in what goes on within Kerry's organisation, and we have really close links with the work that we do. Thanks, Kerry.
Thank you. Anybody else have any questions?
No, just we don't seem to see it as much in the community. I don't know why. Is it the information's not getting out about it? Just my view.
Yeah.
I mean myself, I'm from a tech side and could probably help out on stuff like that. So it's just my view.
Our organisation supports voluntary sector organisations rather than individuals. So we do work with volunteers. So we have lots of volunteers on lots of volunteer opportunities on our website. But there's a new piece of work. You might have heard of the Community Champions, which is a programme that Living Well hold, and they work with individuals in communities that want to make changes. And they've recently received, well, the whole borough has received new funding for the Community Champions. And so the idea that we're working on, and I've got a meeting with Kate about this and other things on Friday, is to connect each of the thematic networks, which is made up of voluntary sector organisations, offer the new Community Champions an opportunity to be linked to one of those, so that we would bring in that individual's voice, those kind of residents that want to support and help. So we're not directly set up to work with individuals in the community, but this new programme, Community Champions programme, will absolutely link our work to individuals. So hopefully that will change.
Thank you. Any more questions from anybody? No, David.
You stated this during the presentation that the community food warehouse, there was a very high demand for food. And I can remember the position with shelves in shops being empty, etc. How has it changed? Or is it just the same?
Well, shelves in shops, remember there was no pasta. So what the supermarkets did is ordered, the supermarkets all ordered bulk pasta. And so now every food bank and every food pantry and the warehouse has its shelves full of pasta because it's all ended up with us. So if you ever need any pasta, it's where we are. More seriously though, we did the food provider research. We completed that. I think that was published in August last year. But it took a few months from collecting the research. So that's available on our website. So I can send you the link which shows it's things like how many individuals are you supporting each week, how many staff and volunteers have you got, how sustainable is your service. We've just actually recently completed that research again. So exactly the same questions, and we're working with the council's data and intelligence team to produce that, to publish that. So we'll have some evidence soon to say exactly how that's changed. But I can tell you anecdotally, the calls through to the helpline at the council have decreased dramatically. So there's now kind of 11 calls a week or something like that. But the food banks and food providers, the need for provision has again gone up. And we think that's because at the council, at the signposting end, they're doing such a great job of signposting through to food banks if people need emergency food, or pantries if they can pay a bit and they can, get a bit more of a sustainable offer. We're also doing some work to strengthen food pantries. Food pantries is kind of a halfway house between buying your shopping and getting a food bank voucher. So people pay, I think it's between £3 and £5 a week, and they get between a £12 and £15 shop for that. And there's been a couple of new food banks that have been set up in the borough due to the needs. So there's one at KYP. We're working with Rochdale Borough Housing to put together a how to start a food pantry resource, because there's lots of groups that are wanting to do it. There's a couple of churches and there's quite a lot to think about. So manual handling and the health and safety side of setting up a food bank or a food pantry. So we're trying to support with resources to help people do that as well. But it's definitely increased. And I think at the beginning of the pandemic, it uncovered an underlying problem that maybe wasn't as visible. But now that problem's increased because people are losing their jobs. Particularly people who are self-employed, haven't got that regular income, and so are having to turn to additional support. So it's not a great picture.
No.
Thank you.
Thank you, Kerry. That's very interesting. Thank you very much. And I say, I'm sorry it's taken us so long to get hold of you.
Oh, it's all right. I'm glad I'm here now.
Maybe it was appropriate that we waited a while, because obviously all these systems are in place now and set up, and they're all across the borough, which is good. So thank you very much.
More than happy to come back anytime you want. And I'll just pop the Equalities Assembly link in the chat if anybody wants to have a look at that one as well.
Thank you very much.
Sarah.
Thank you.
All right, I will go. See you later. Thanks, everyone. Bye.
Right, if we start working our way down the agenda now. Questions from the public?
None received.
Sorry?
We haven't received any.
Oh, that's fine. Thank you. Approve the minutes, deferred due to cancel. I think the last minutes we had were approved on email, weren't
That's
they?
right, yeah, in January.
So I'm not sure there are any matters arising that probably haven't been dealt with or will be dealt with as we continue.
No, nothing that I'm aware of.
As usual, I have to ask, are there any declarations of interest from anybody attending? Good. Right, so we'll go on to the action log.
You okay sharing that? Yep, Claire's on it, I think. Claire, you sharing that or? That's the agenda. Well, in fairness, all actions are complete. So there's nothing to really go through on the action log. There was a couple that were due in December, but everything was completed. So there was no actions to follow up on.
Right, thank you. And then we're now on to your update, Kate.
No problem. Claire, can you stop sharing so I can share my presentation? Thank you. Bear with me.
I think this is the document you sent round the other day, isn't it?
Yeah.
Yeah.
I'm gonna have to bear with me 1 minute. I had it open ready, but for sometimes it just doesn't recognise it when it's your time to share. Good old technology. Try again. There it is.
That's it.
So is everyone okay seeing that?
Yep.
Yeah. Thank you.
Yeah, excellent.
So this is Q3 update from myself in regards to the work that we've been doing. So today I'm going to cover meet the team because we have got a new member of staff who is on the call today, Rob. So welcome, Rob. Operational update covering engagement, volunteering and communications, and then a strategic update on some of the work that's been going on in those particular areas. So first of all, a picture of our team. So Rob has joined us on Monday as the company administrator. So he's going to be working very closely with myself and you guys as the board to help develop the governance and strategic element of the business. And obviously you're aware of everybody else that's on the team. So we've got Claire, Naomi, Tracy, Rob and myself now. And we will be going out to recruit a administrative support worker come April once Rob's settled in a bit more because they will sit underneath Rob. So in regards to updates, so we've been really busy. Naomi's been really busy around our volunteer work. Obviously, it's been a really strange time for us during COVID because usually our volunteers are normally out on the ground with us doing interim views and various other projects, but it has given us time to really step our offer around volunteering up. So one of the key pieces of work that Naomi's been working on is the Quality in Action Award, which is a kite mark, which we are in the process of receiving. And it's just really showing a high quality of standard to the offer to our volunteers and making sure we've got all the right documentation in place to support the process. We've recently, we have a couple of admin volunteers that support us normally in the office on a weekly basis. And due to COVID, obviously that's stepped down, but we have now shared laptops with one of the volunteers and they're backing and supporting with us home-based, and the risk assessments have been completed there. So just getting the volunteers slowly back into the work that we're doing. You know, we've done a lot this year that hasn't enabled volunteers to be involved. So just to make you aware that we are on steps to sort of like promote that back into the business again. Volunteer recruitment, we've brought extra volunteers into the advisory group, and which I'm now currently set with 8 members, which have a really good demographic reach over the borough. And Rosemary, as a board member, attends that meeting on a monthly basis. So we've been doing a lot around our Youth Watch. And we held a competition, which was a really successful competition. So the idea was that the youth young people would create a poster to help us advertise the up and coming Youth Watch recruitment. So there's a call tonight this evening to announce the winners of that, and there's £50 Amazon vouchers for the top 3, and then 5 £10 Amazon voucher runner up. So it's been a really positive piece of work. From a collaboration and stakeholder perspective, we've made really good links with schools. And on the back of this work, we ran 3 quarterly stakeholder events, which was really about getting the local organisations which are doing similar work with the youth involved in what we're trying to do. And obviously ours is very different because we want their voice and health and social care services. So it's been really good. And we have judges on the panel for the presentation from Action Together and Skyline Circus. And then we're currently in the process of doing a piece of work with ACRA and Northern Care Alliance. and this is a commissioned piece of work that we've been doing, and it's working collaboratively with them to recruit lived experience panel members, and their role is to be involved within the Northern Care Alliance setting and look at the Q&A within the delivery of service. So moving on to our communications update, a really busy time for us with our communications, and Claire does an amazing job at pushing everything out. Obviously, with the way that we work now, we've had to really change our way that we deliver around our communications, and our stats within our communications has really improved. So we've recently done a communications report which ran November, December and into the beginning of January, and we got a total of 683 responses there. 459 responses were digital, and 220 paper copies were received, but 1,927 paper copies went out across the borough, and that was with support from voluntary sector organisations in getting those paper copies out there. So we've currently got a live survey around vaccines to try and understand a bit of the insight and behaviour around people being reluctant to have the vaccines. That's been running for 2 weeks, and we're really pleased to report that we've had 378 responses on this already. So the data from this survey is going to be fed into the system, specifically statutory partners, public health. Sorry, that's my puppy crying in the background. Public health, trying to understand why people take up the vaccines, and I've done a video to really try and promote that, and we're going to be sending something out to volunteers who have had the vaccine to say why they've had the vaccine, so we can promote it in line with the survey. So if you have had your vaccine and you receive, there's going to be a speech bubble that's sent around that we're just asking for people to take a picture with and to say why you've had the vaccine. So current other comms campaign at the moment, we've got the hospital discharge feedback campaign where we're asking for specifically feedback around that process. The pain management clinic, and as I've already alluded to, the COVID-19 vaccines. So the hospital discharge feedback and pain management has come on the back of the advisory group. So it's been identified as key issues within the services. So we're pushing for more evidence-based information to be able to hold the system and provider and commissioners to account around those areas. So in the last quarter, we've put out 12 press releases, which is a lot for us. And I think 1 week we sent out one every day, which is really positive. And 5 of them were published on Rochdale Online, which is obviously a key achievement for us to get those publicised for more of a reach locally. And then our website sessions are up. So over the quarter, we've received 3,720 website users. Average session duration is 3 minutes. And social media, we've put out 1,197 posts. So you can see really, if you was to pull back over our previous stats around our comms, we've really upped in this area. So moving on to engagement. So the advisory group is a key part of our work stream on an operational basis monthly. So we hold a monthly meeting. As I've already mentioned, we've now got 8 members who bring a range of lived experience and a commitment to represent the views and needs of the wider community. So they do have broader outreach within their community settings. So it's really positive, and I don't want to go into too much detail because I'm going to run through the advisory group report as part of an agenda item further on. But the work there around the advisory group is really developing, and we're looking at what they need from us as an organisation to develop them within the role of the advisory group. So a big piece of work for us over the last quarter has been the Moving On service. So the Moving On service was a service which was run in Middleton, specifically Alquinton, and it was a service to help re-enable people back into normal life after certain injuries such as brain injuries and different disabilities. The service closed after a consultation by Rochdale Council, and concerns were raised to us through various different people, organisations about the closure of this service and the way in which it was done. So over the last 3 months, Tracy, our engagement coordinator, has spoke to 42 ex-service users and done an online sort of consultation with them. And there's a report that will be going into the council to highlight the key concerns and some recommendations as to where they failed in the system for the service users. It's a really big case, this, and some of the individual ex-service users have actually taken this to the Health Ombudsman. It does highlight poor practice within Rochdale Council. So yeah, it's a big piece of work, and we've spent a lot of time really engaging with those people. But it's very important to highlight that we've had to set limitations to what we can do as an organisation. So we've been very clear with the service users that it's not a case of Healthwatch, you know, re-establishing this service and for it to kick up and start up and running again just because we've raised concerns. but it's about the support because this service is gone, of what other people, what they're receiving in the meantime. For example, a lot of people have care plans in place, and it's understanding, you know, have they had reassessments on their care plans? And unfortunately, the answer is no. So a big piece of work that we've been working on, and a really good report that Tracy's now produced. So the Mental Health Forum. So Healthwatch Rochdale have worked with the previous members of the Mental Health Forum and Action Together to co-produce a new partnership group, which will be implemented for this financial year. The meeting will focus on emotional health and wellbeing. So it's what Kerry showed you on the diagram there. So previously we held a monthly, over the last year, we've held a monthly mental health forum, which has been Rochdale residents as well as providers bringing concerns to the table. And it's been really successful, and we've reported up to the Mental Health Partnership Board and tried to hold the system to account on lived experience. But there was more of a need for this to change slightly. And obviously with our annual work programme, we changed that up as well. And what we were conscious of as an organisation and living in this new virtual world is some people were very reluctant. We didn't have the uptake from a lived experience and service user perspective on this forum. Because it's quite intense discussing your personal experiences on Zoom sometimes, and people don't always want to sort of like deliver that information. So that's changing, but it's morphed into a new emotional health and wellbeing group, which Healthwatch will be involved in, but we will not facilitate and hold anymore. So just wanted to highlight some key stats. Sorry, let me go back down. Some key stats, and I can't see that, so I'm sure you guys can. So just to let you know that over the last financial year, so April to sort of like beginning of March, we received over 220 pieces of individual feedback relating to health and social care services. We attended over 150 local health and social care meetings over the year. We've signposted 181 Rochdale residents to various organisations for support. We've held 6 mental health forums with professionals and residents with over 20 people on the call, and 6 reports have gone up to the forums, to the health Mental Health Partnership Board, which is led by the local care organisation. We've had 10,775 website visits. We've held 20 focus groups over the year with Rochdale residents. We've done 5 surveys with a total of 1,457 responses. We've received over 700 calls into the organisation for various different reasons. We've done an organisational restructure and recruited 5 new members of staff, which I think is key to say that we've still carried on delivering the service. Obviously, we implemented the Together Rochdale communications group, and with that produced 18 e-bulletins, which has been a joint piece of work with voluntary sector and statutory partners. We've held 3 public board meetings, which are live streamed to our YouTube channel. We've had over 320 hours of volunteer support into the organisation, which I'm really proud of, because I think to say we've switched to that virtual element and we've not done our end-to-end views, which is normally a key element for our volunteers. It's really positive. We've created 36 local press releases that have gone out. We've had 310 new Facebook followers over the year. We've recruited 4 new board members. We've had 143 new Twitter followers and posted out over 1,000 tweets. We've recruited 5 new advisory group members, and we've arranged 3 stakeholder meetings to help develop our Youth Watch. So it was just really a snapshot of some of the stats that, you know, we've done over the year. And obviously they're not final stats. Our final stats will go into our annual report, which is due in June. So moving on, I just wanted to touch upon, so obviously this year, as you all know, we decided to do two stakeholders surveys, sorry, 2 360 reviews. So normally we just work on a stakeholder review, and we engage with our local professionals to see what they know about our service. But obviously, as our bread and butter is serving the Rochdale resident, we thought we'd change things up this year and implement that resident response as well. So just to go through the findings of that 360 resident review. So 47% strongly agreed that they were aware of the role of the Health Watch. So we asked specifically about engagement as part of the survey. And one of the questions was, I am aware of the role of Health Watch Rochdale Advisory Group. 46% strongly agree. Oh.
Sorry. Switched off. Sorry about that.
No problem. So 46 strongly agree or somewhat agree with the statement. Health Watch Rochdale aim to be inclusive to all communities across the borough. 50% strongly agree or somewhat agree. And Health Watch Rochdale engage well with local people. 54% again strongly agree or somewhat agree with the statement. So communication, information and advice. So Health Watch Rochdale communicate well with local people. 50% agree or strongly agree. Health Watch Rochdale provide the public with accurate, reliable, relevant and useful information about local services when they need it. Again, 50% strongly agree and somewhat agree. And Health Watch Rochdale provide members of the public with appropriate advice and information to raise a complaint about the part of health and social care system. And I can't see what that figure says because my screen's covering it. And I'm not
50%.
Sorry, say that again. Is it 50? Thanks, Rob. 50% somewhat strongly agree or agree. So how could we be more effective in this area, which is something I think is more important, because obviously the figures there show that we've got a lot of work to do about raising our awareness. And we all know always, you know, this is something that's historical for us as such a small, low funded organisation. So make people more aware of your branding, raise awareness. I was only aware of you when I was signposted to you by adult social care issues, publicity, and not just online, but local presence. And how could Health Watch be more effective in the communications and information advice? Explain what you do, what the service is, and promote the service. Leaflet each household in the borough, which would be brilliant if we could financially afford to do that, but unfortunately we can't. Keep doing what you're doing. So I've put that in there because I thought that was good. You know, some people who are aware of our service obviously promote the work that we're doing. So, and again, amazing work. And then have a physical presence as well as an online information standards, as well as online, and then information stands in supermarkets. So obviously COVID has knocked our face-to-face engagement off this year, but we are normally heavily in pockets of the community across the Rochdale Borough, covering all 5 townships. So next up, impact. So
just a quick one on that one. Did we ever compare other health watches that have carried out similar surveys and what engagement they're actually getting?
No, we don't. I think it's difficult, Stephen, because every borough is so different, and every health watch is commissioned differently. I mean, obviously they have to follow the statutory functions, but it's quite hard because every community work different and every health watch have their own agenda really in regards to their annual work programme. In regards to the stakeholder, maybe a bit different. Maybe that's something more that we could look at baselining against other health watches. But for me, I don't think it's about comparing ourselves against others. I think it's just about us improving how we deliver to the Rochdale residents.
Yeah, quite agree with that. That's what we're saying. If we look at other health watches and they're getting better, how can I say, engagement or worse engagement, what are they doing different to what we're doing? And that could be something for the future. That's just an idea.
Yeah, I mean, we share good practice with a lot of the Greater Manchester. So we have Greater Manchester Health Watch meetings. So the 10 in the GM borough come together. We meet as chairs and chief officers, and there was also an officers meeting, which is suppose everything under that strategic level. And that's very much about sharing good practice and, you know, people trying different things. We also have the Facebook Workplace, which is Health Watch England led. And that's a really good talking point and information source to find out what other health watches are doing. I mean, what you'll know is that Health Watch never sort of like reinvent the wheel. Someone out there will have always done a similar piece of work to what we're looking at. So we really do try and work on best practice within this within the Health Watch footing.
Yep, like I said, carry on with the rest of it. It was just an idea. If there was something that other health watches had done a similar sort of thing, you know, how did we compare to it? What are they doing different than us? That's all it was.
No problem. So around the impact. So Health Watch Rochdale support local residents to make a difference to local health and social care. So 46% strongly agree or somewhat agree. Health Watch Rochdale make a difference to local health and social care services through their reports and recommendations. Again, 43%. So our work plan. I'm aware of how Health Watch Rochdale create their annual work plan. 32% strongly agree or somewhat agree. I'm aware of Health Watch use residents' feedback within the health and social care system of Rochdale. 43% strongly agree or some. And I'm aware of Health Watch Rochdale's statutory powers, which was 32%. So how could we be more effective in our impact? So monthly updates, publicity, promote services, more awareness sessions, and more power to make local health and social care services take remedial action. And then how could Health Watch be more effective in this area? So again, publish improvements, raise profile, make residents more aware of their rights, public meetings in Haywood, Middleton and Rochdale, which is something we did previously. We went around each township for our board meetings, and more information and communication with vulnerable people. So just looking at the demographics of that information that came through. So 50% of respondents were female and 46% were male. 88% were white British and 92% were heterosexual. 68% were homeowners, 4% were tenants in social housing, 8% were tenants in rented or and accommodation, and 20% were under other. So we heard from all age ranges, from under 18 years of age to 75 years plus, so we did cover a good age range. 32% of the respondents considered themselves to be a carer, 11% considered themselves to have a disability, and 16% considered themselves to have a long-term condition. And then just looking at the demographic breakdown of respondents, so we have 28 people lived in Rochdale North, none from Rochdale South, 28 in Middleton, 8 in Rochdale, and sorry, but I can't see those, 28 others, and I don't know the figure for Pennines because my screen is covering it.
8%.
Yeah, thank you. I'm going to say I'm sure you guys can see that. So obviously, not the best response in regards to that residence review, but I feel like it's a really good baseline to start looking at how we improve and get that public more aware for the Rochdale residents, because that is our service, you know, that's our service users at the end of the day. So I've created an action plan as to how we're going to improve this within the organisation. So we're going to create communications campaigns which highlights what Healthwatch Rochdale does and identifies our statutory powers. So this is something that we're going to consider throughout the year and really promote what we do. Raise awareness of our Healthwatch Rochdale branding. Our branding is quite unique, really, and it's really bright and colourful and eye-catching colours, I feel. So it's really about pushing that out a little bit more and getting it into our pockets of community, both online, on the ground as well. So create new information leaflets which highlight the role of Healthwatch. So that's something that the team are working on at the moment, ready for the new financial year. So making sure that we're really covering everything that we do, but in an easy read format for all our Rochdale residents. Distribute leaflets across the Rochdale borough. Now, obviously, going back to the comms survey that we did, you know, we got over nearly 2,000 surveys out on the ground. So it's just thinking about using our stakeholders and supporting us in trying to distribute our leaflets. It's been difficult because normally we'd have them in GP surgeries, dental practices, libraries, and we'd get them posted out around. But with them being shut, we have seen, obviously, we've not been able to utilise those areas this year. So it's really reintroducing that. So next action, to reintroduce paper copies of Healthwatch Rochdale's quarterly newsletter to go out online as well as physically across the borough in various locations. So that will really promote the work that we're doing. The bulletin that we do on a monthly basis is about what the health and social care services are going on across the borough, so not necessarily specific to us, whereas our newsletter on a quarterly basis is very much about the work that we've been completing and been doing on the ground and virtually. So reintroduce that and get them printed off. And then raise Healthwatch Rochdale's profile by attending local township meetings across the borough. And that's really to promote our role to the councillors so that they can then signpost their constituents into the organisation so we can support them in different ways. So what's next? So Healthwatch Rochdale will add these actions into our operational work plan for this next financial year. This will be shared with the board, obviously like I'm doing now, to ensure transparency and accountability on the action plan. So what I suggest is there's an update on specifically on these actions as to what we're doing on a quarterly basis to try and raise our awareness and the actions on the plan. And then Healthwatch Rochdale would hold a focus group. So unfortunately there was a focus group and I waited on the call for half an hour, but nobody attended. We did have 9 people sign up to the focus group, but nobody attended just to go through the detail in a bit. Sorry, to go through the information in a bit more detail. So the offer was there, but nobody attended. So I'm just going to pause at that point to take any questions on that before I go on to the stakeholder survey. Silence is good. Okay, to carry on. Okay. So the key findings of the stakeholder survey. So you all got to see the questions that went out to the stakeholders, and there was some not concerns but question marks with yourselves in regards to, you know, do they understand what we're asking? And I think in regards to this, just to highlight straight away, on our Survey Monkey link, it showed us that we had 18 responses. But actually, when I came to analyse the results, we only actually had 4 responses, which is really low for us on an uptake, considering we did an event last year, a face-to-face event last year, where we had over 22 local organisations and statutory partners. So for me, although the figures are what they are, but it's not very, it's not good data to be analysing with only 4 responses. So rather than go through the figures there, I thought it'd be good to say what comments came out, because for me, that, like I said, the figures are quite swayed. So the first question's around strategic content and relationships, and we asked how we could be more effective in this area. And the comments that came back: it's difficult to commit on relationships and partnerships Healthwatch have established, may help to quantify inputs and outcomes, which result. Sorry, but I wasn't aware of that organisation existed up until now. I have never seen any reports produced by them. I say they, having worked in Pennine Acute Trust for 35 years, and more power to hold. Sorry?
I find that quite appalling, Kate.
I'm really
and surprising, because we have a lot of contacts with the Pennine Acute. Obviously she doesn't say where she works. I'm saying the person doesn't say where they work, but I cannot believe that there is nothing in the Pennine Acute that advertises our services.
I know, and I think, again, I can highlight what this stakeholder got sent to over 50 strategic leads across the borough, as well as, lower officers within the health and social care services. And to say we only received 4 responses, Jane, I was really disappointed. We normally have a really good response to our stakeholder review. And I don't know if it's just everyone's so busy, time pressures with COVID. I just don't know the answers, if I'm honest. But I thought it'd be good to highlight some of the comments, because I think for me, as much our role is to really empower the residents. So the fact that a Pennine Acute worker was unaware of the service, for me, that's a bad reflection on Pennine Acute, who we have very good relationships with. But I agree, it is disappointing. So, and then the final one was more powers to hold decision makers to account. So making a difference locally and nationally. Again, the stats are there, but it's difficult because there was only 4 responses. So how could we be more effective in this area? Obviously important to have in place, and may well be positive evidence. Unsure how widely this is known across the community. Influencing local decision makers is limited by lack of influence with national decision makers. And need a whole raft of existing council employees in position or accountable and powerful. Accountable and power in some cases for many years to resign and retire before really challenging accountability is allowed to happen. Sorry, I pulled them, so some of the language isn't the best. Next one is informing people. So how could we be more effective in this area? Health and community care services appear complex and they're interrelationship muddled. Healthwatch can only reflect the structures imposed nationally. A&E, local hospitals and GPs are understood by the public. Commissioning health structures and relationships between public and private sectors are very confusing. Healthwatch could assist in clarifying for the public. However, this may require major investment to succeed. And then nationally, there is, sorry, I keep getting, I think it's because comments are coming in. Nationally, there is, I can't read that last one, so I'll let you, oh, there we go. Nationally, there is scores on the door scheme for takeaways and restaurants, and similar schemes for GP surgeries, dentists, mental health providers and NHS commissioners. So that's basically saying we need to avoid some things at all cost. So community voice and influencing. So how could we be more effective in this area? The existence and role of Healthwatch to be more clearly understood by the community, particularly its independence, and clarify of its powers. And then relationship with the wider Healthwatch network. The role, structure and capacity and powers of Healthwatch needs to be more widely understood. So similar responses really, it's really about getting out there what we do. And the complexity of the sector suggests that there's a need to simplify health and social care services or provide significant Healthwatch resources to tackle the changes to improve the community understanding. So I think it's good that whoever's answered these, there's a recognition there that, you know, we are underfunded in regards to the work that we're doing. And then who responded? So like I said, we had 4 responses, although our Survey Monkey said we had 18. So 18 people clicked onto it originally, but never actually completed it. And 2 were members of the public, which should be, that's looking at where we've put that out there. So really, this isn't a public survey. 1 member was a lay member and of the CCG, and 1 was from Diabetes UK. So obviously, like I said, not the best results there. And I think the message across the stakeholder and the residents' response is pretty similar. So the action log here is to complete stakeholder event next year to improve number of respondents. Like I said, that was really successful last financial year. So we'll look at redoing that, even if it is virtual. Increase awareness of Healthwatch Rochdale work with local health and social care professionals and stakeholders. Now, normally throughout the year, I'd really engage with sort of like strategic leads within various providers and with providers and commissioners. That's been a little bit difficult to do because everything's been so hands-on with COVID. So reintroducing that and making sure we're engaging across. Ensure the next year 360 review asks more relevant and understandable questions. So I think strip this back a little bit and just review what questions we are asking. And by doing that, I will look at, just touching on what Stephen said, look at what other health watches ask their stakeholders. Share key decision-making documents and procedures with local partners and stakeholders. So that's really sort of like looking at some of the implementation that we're looking at around the Healthwatch England standards, the impact tracker, and really holding the system to account in an open and transparent way. And raise awareness of Healthwatch Rochdale with local residents, which was one of the responses. So they're the actions there. So I'll run into the next bit now. So if anyone's got any questions or comments on there, I'll just stop for a minute and take them.
Do you think that the fact that we couldn't hold the stakeholder event like we did the previous year has had an impact, because we got a very good response from that workshop that we held, didn't it?
Yeah. I really do think that I mean that stakeholder event that we ran it over at KYP. It was really good. We had all 22 organisations sign up to a pledge of what they were going to do for the next year. But obviously COVID's just kicked in, and it's become we've become so far down on the list. Even in regards to some of our statutory recommendations that have gone out in reports, we've not had the same response as what we normally would. So that's something where I'm really keen in our new decision-making policy coming into play. And really, showing our powers and holding the system to account in the appropriate ways that we can. So yeah, I think the event did work better for us, and that was we did the event for the first time last year. But obviously with the current circumstances, it weren't an option. I do wish now that I'd maybe considered a virtual event, but I suppose, you learn from the outcomes really. So that's where for me, so next year we will definitely do the 360, and it'll be either a virtual event or hopefully a face-to-face.
Yeah, I think as well, that maybe you wouldn't have got the same response this year because people are so busy with all sorts of other things that getting people to do yet another virtual meeting is quite difficult.
I know, but it's difficult, Jane, because to me, within my role over the last year, I feel like I've been pulled from pillar to post a little bit with the health and social care commissioners and statutory partners. Me jumping through hoops to attend meetings and stuff like that. And the people that, I've been there to support haven't necessarily supported me in the 360 review, which is quite disappointing really, because the relationships are there. And obviously that shows in the figures for the number of responses. Like I said, there was over 50 people that I personally asked to complete the survey. And we got a 4-man response. So yeah, I think it's definitely a different way to deliver this next year.
Simon, you want to say?
Thanks, Jane. Yeah. All I'd say, Kate, don't beat yourself up over it. Or us as Healthwatch, we have gone through massive in the health service. I can't say how much change is happening and frustration and workload. So, and despite very good relationships, I suppose in terms of priorities, the COVID stuff has taken over everything else. So the number of emails that come in now and Teams meetings is phenomenal. I'm working in a sector now currently where it's just overloaded with everything that's going on and demands from central government. So whilst it's disappointing, we're in a very different environment than we were a year ago. and we have to accept that. You know, that's where we are at present. So that's all I'd like to say.
Yeah, no, thanks, Aaron. I appreciate that. And I think for me, like I said, you know, you can take the horse to water, but so the offer's there for them to be involved in our 360 review. And I think obviously there's stuff that we're taking away in regards to the action plans. So I think just on the what's next, again, this action plan will be reviewed at the public board meeting on a quarterly basis to show how we're engaging more with our local stakeholders. Am I okay to move on?
Yeah.
Thank you. So moving on to the workplan consultation. So this is an annual consultation that we go out for every year to sorry, let me just bring that presentation up. So we go out on this every year to identify what our key work streams will be for the next financial year. We work on this through our trends analysis. So we review what feedback's come in and we give various options in regards to that public consultation. So this year we received 54 respondents in total. 87% were residents and 13% were professionals. So the two key topic areas for us this year will be community mental health, covering all ages, and GPs or general practice. So 94% agreed that the residents grouping is needed, with 79% confirming they would like this to be a face-to-face. So we're going to be looking at setting up a forum there. 61% agreed that Health Watch Rochdale should continue with the Together Rochdale communication group. So that's in our work plan for this year. 75% agreed that the Health Watch Rochdale should continue with the interim views in care homes. So we're going to continue with our care homes, obviously bearing in mind the COVID restrictions at the moment, and they're going to kick in hopefully from September. And we're going to look at doing 4 care homes across the Rochdale Borough. So, and also other key work streams which were identified and continue to be key areas for us on an annual basis include obviously collaborative partnership working with voluntary sector, faith and social enterprise organisations and statutory partners. Our information, advice and signposting surgeries. Seldom heard engagement, so really getting into the pockets of the community that really don't have a voice. Health inequalities is key on our radar as well for Health Watch England and also locally. And as Kerry also mentioned earlier on, I attend the Equalities Assembly. Every time there is one, I give an update in the main room, and we also help support one of the facilitation side rooms. Advisory group development, this is really key to our bread and butter of what we're doing now, and the meetings are really successful. We just need to look at increasing members. And then safeguarding is obviously across everything that we do, both safeguarding adults and children. And then the development of our Youth Watch. Now the competition draw will be pulled this evening. Then it's about going out to recruit and working with the schools to get that youth voice coming through. So this is just a bit of and I apologise because I know it's not very big, but this is, and you'll have seen this in the other document that I've completed. So this is just a table to really highlight where our work streams are going to be this year. So we've got 8 key work streams and how this fit into our statutory functions. So across the top is the 8 statutory functions that Health Watch Rochdale have to deliver as part of our contract arrangement. And these are the statutory functions that are written in the Care Act. So I'm not going to go into too much detail on that just because it's on a separate document. And then that's that for the presentation. So I'll take any questions if anyone's got any. No? Okay. So moving on then, I just wanted to update you on the, oh no, that's fine then, Jane, if we can move on to the next agenda item.
So the next thing on the agenda is the advisory group report.
Thank you. So I'm going to take the report as read. Thanks, Claire. It's quite a long report, but we've shared it like this to really highlight all the information that we're working on as a group. As I mentioned before, Rosemary Nunwick sits on this meeting as a Rochdale resident, but obviously she is a board member as well. So every month there's a report that comes through to the advisory group, which Claire's highlighting now. And it's a feedback report, and it highlights all the information that we received that previous month in hand. So really looking at our feedback that we receive, any individual concerns that are raised, and also our care opinion data. So the feedback report is key to the delivery of the advisory group. So that takes up a good half an hour of the agenda item to really look into these individual pieces of work and decide if there's further actions that need to be done to gather further information, to look into these areas that people are concerned about in a little bit more detail. At the last March advisory group, like I said, there's 8 members at the moment, and we have recruited 1 more. We had 2 guest speakers come along. We had someone from Manchester Foundation Trust who, Claire, you can stop sharing it. It's okay. I'm not going to go through the full report. Thank you. We had 2 guest speakers come along. So one were from the Manchester Foundation Trust to discuss the changes to the North Manchester General site with the transactions that are going on between Northern Care Alliance and the Manchester Foundation Trust. And we also had a guest speaker, Charlotte Mitchell, who's the Children and Maternity and Mental Health Commissioner for HMRCCG. And she gave an update in regards to some of the concerns that had been raised previously towards #Thrive. So #Thrive got moved at the very beginning of COVID, and there was no public consultation around the move. So it moved from the central Rochdale position to Haywood Darnhill. So there was really big concerns around people being able to access the site. So we asked for EIAs to really sort of like zone in and see what had gone on there. And it was identified that there wasn't an EIA done on the move. So they're sort of like trying to backtrack now to look at that. So Charlotte came along to reassure us with the work that's going on there. So just to give you really a flavour of what sort of stuff the advisory group are working on. Another key area of the advisory group is developing them as individuals, you know, the volunteers within the organisation, and upskilling them to be able to fulfil the role of an advisory group member. So as you've all been invited to, we've got training at the end of the month to look at EIA specifically, and we've got the Equality and Diversity lead from across the Rochdale Council and CCG coming to deliver that training. And it's really just to identify what to expect to see in an EIA, which is an equality impact assessment, so that we can make sure that we are holding the system to account correctly when we're reviewing them, so we know what we should be seeing in them. So like I said, the advisory group is a really positive part, and it's been a massive development area for us over the last 12 months. It's very time consuming because of the amount of issues that are coming through, and we are starting to look at how we can support. So if an advisory group member comes with one particular issue that, you know, they're aware of, we ask them to go back to the individuals that have raised it to them and put that feedback onto the system. And that's an area that we're slightly lacking in at the moment, because we can't act without the evidence. So what we're looking at doing is creating business cards and leaflets specifically for advisory group members, which will hold our text message service and our QR code, which are being implemented for the next financial year, so that people can utilise the feedback system on our website a bit easier to really get that evidence-based stuff coming through. So I just wanted to give you a quick update there in regards to where we're at. Also, just to note, Karen Kelland, who would normally deliver this update, is unfortunately been away from her role due to ill health. So Karen's hoping to come back in April time to fulfil the role of chair of the advisory group. But as it stands, both Tracy and myself have been facilitating the group. So obviously you've seen the report, so I'll take any specific questions anyone may have.
Thank you, Kate. It's nice to see the advisory group is up and running and really doing some good work. So hopefully that will carry on for the next year, and we'll get lots of information back from them. So thank you. Right. Any other business that anybody wishes to raise?
Sorry, Jane, you've missed an agenda item off there. The work plan.
Oh, sorry.
Number 10.
No, after the that was in the other bit. Should it have been after the advisory group?
Yeah, so it's our priorities for the year, which is the report, and then I just wanted to get approval on the work plan for next year. Have you got it up there? Oh no, it's not. Oh, I've got it on mine. Am I okay to? I'll do it under any other business then. That's fine. Claire, can you stop sharing so I can just pull the work plan up? So obviously I shared this with you all. Let me share my screen. So this is the full document. which we send out. So there's an introduction there to external residents, to stakeholders, as to what this is, what this document is. And it highlights there again that this is our work plan, is delivered our core statutory functions, but it doesn't include any commission pieces of work that we might pick up. So this just identifies, and it needs reformatting yet because it'll go into a PDF format. This is draft format. So this is just explaining what our outcome measures will be for the year, and also our special delivery functions, which are obviously our statutory functions. And then the table, which I highlighted in my presentation, this is that, so GP access. So if we go further down, there's a work stream for each area, which shows what our objectives, our aims, and the timeframe delivery outcomes will be. So there's 8 streams of work that we're looking at doing this year, and there's timeframes to each of them. So it was really just to seek approval from the board for this work plan for the next financial year, starting from the 1st of April, and take any questions that people may have. So Ben's made a comment saying he approves.
Ben's got his hand up.
Yeah, I thought it was very thorough.
Yeah, no, sorry, that was for a notification of some other business. So after this item, I'll, if I can be brought in, that'd be great.
Okay. Anybody else got any questions on the work plan?
Yeah, I was just going to say, so my hand's up, but I don't know if you've seen it. I think it's very comprehensive. I'm just conscious of capacity. That's all, Kate. So I just think we need to bear that in mind. There's a lot there we're going to be doing, but if we have to prioritise, we may just have to move things down. That, in that sense, might we? Because as we know, the environment is very variable at present out there.
Yeah, I mean, if I'm honest, Simon, it's probably less than what we've committed to over the previous years. So, thinking about the new environment, I am aware of that. But some of it's our core contract requirements.
Yeah, I appreciate the core stuff.
Yeah,
we can't
so it's quite difficult. And obviously, yeah, I take that on board. And I think obviously this is the place to bring that to on a quarterly basis and update the public with that as well. But we aim high.
Oh, yeah, of course, we should always.
I think as well, it will obviously depend. It is quite an extensive work plan, but hopefully if things do start getting back to normal, then you can do that within the time frame. It will all depend if things get put back, I suppose, because that's obviously the impact.
Yeah, and obviously there's the element of our volunteer development and looking at how the volunteer roles can come in to support the development and delivery of the work plan, which is normally what their role would be, being out on the ground with us during engagement. So it's looking at how we utilise Naomi in her post, because obviously that's fairly new. She joined the organisation in August, and we've never had that designated support for our volunteers. So looking at how we can develop and what offer we're giving to our volunteers and what offer they're giving back to us, really. So we're hoping to develop that support mechanism with our volunteers.
Okay, good, thank you. Anybody else got any questions? No.
Just making sure that we've got adequate milestones in so that we know where we are with those work plans. That's all. I just think something for each quarter coming back to the board where we are against this particular milestone, so we know if we're in front of it, we're behind it, or whatever. Just my view.
Yeah. So obviously this is an external document that goes out to public and stakeholders. Behind the scenes, we have a full operational work plan, which is Gantt charted. So that will come through to the subcommittees, finance and general purpose, to give an update, and I'll share it with full board on a quarterly basis as well under part 2 for information only. And then if anyone's got any questions, but yeah, Stephen, we do that. It's just behind the scenes with this being a public element.
Cool. Yep. Go carry on.
Thank you.
Are we ready now to move on to any other business? Ben had something he said.
Is there any other business before I do my bit, or am I the last person?
Yeah, there's not from me, Ben.
All right, excellent.
You, Ben.
Thank you, Chair. I wanted to do this as part of the public meeting, but as everyone knows, this is Jane's last meeting in Chair and a board member. So on behalf of the organisation, I want to thank you for your service over the last few years. I think it's been 6 years, has it, Jane, since we started?
I think it's only been 5.
5 years since we started. I think we've come a long way as an organisation in those years, and there has been certainly some turbulent times. We're in a very turbulent time at the moment, but I think we've definitely progressed as an organisation, and it's been you who's led us through those times. You'll be leaving the organisation in a very good shape. Normally, of course, we'd come together and have a bit of an event, but sadly, because of COVID, we can't do it. So again, I just want to thank you, Jane, for all your hard work, and wish you all the best in the future.
Thank you. Thank you. It has been a pleasure being chair of Healthwatch Rochdale, and as Ben said, how we were 5 years ago to what we are like now is hugely different, and it's really thanks to the team and the work that they've been doing on the ground, and we are, I think people know we're a force to be reckoned with now. So well done, everybody. Thank you.
Thank you so much.
Thank you. So just to confirm, we'll come back at past through our Teams for our part 2 board session, which is not within the public domain.
Thank you.
Thank you.
Thank you.
Bye.